Thanks again for joining us today. We are with Benefits in Action, your neighborhood guide to food and health resources. Our presentation today will cover upcoming changes as a result of H.R.1. Programs that we'll talk about include SNAP, food assistance, Medicaid, and others. I'm Rachel Wise, the Manager of Marketing and Outreach here at Benefits in Action. And today I'm joined by Kelly Kropf, our Senior Manager of Navigation, as well as Anna Marchman-Santeliz, our Manager of Navigation, who is also providing interpretation. And we thank you for your patience today with some pauses that you may notice as we make time for our interpreter to translate. Thank you. So Benefits in Action is a nonprofit organization dedicated to connecting our diverse community with the support and resources they need to thrive. We support neighbors across the state of Colorado, helping them to apply for the benefits they need. And our services are available by telephone wherever you are in the state. So how can Benefits in Action help? So we're a nonprofit organization assisting adults throughout the state with health insurance programs like Medicaid, Medicare, Connect for Health Colorado, Cover Colorado, as well as wraparound services and benefits. We do help with education, navigation of benefits, application assistance, and again, we serve folks all across the state. All right, I'll pass the mic to Kelly Kropf, our Senior Manager of Navigation. Thanks, Kelly.
Thanks, Rachel. Hi, everyone. This will be our agenda for the webinar. We're going to cover under Medicaid, the qualified immigrant changes, 6-month recertifications, work requirements, retroactive coverage restrictions, and then under SNAP or the Supplemental Nutrition Assistance Program, the qualified immigrant changes, and under Coverall Coloradans, some changes for children. So upcoming changes for Medicaid. Qualified immigrant changes will be effective October 1st of this year. We're told that it may affect 7,000 lawfully present immigrants. The following will still be eligible: lawfully permanent residents, certain Cuban and Haitian entrants, and individuals from the Compacts of Free Association nations. The following are no longer eligible starting October 1st. Refugees, asylees, and other humanitarian groups. And if you have questions about who is eligible, please check out the link at the bottom of the slide or call us at Benefits in Action. Under upcoming changes for Medicaid, the work requirement and 6-month renewals will only apply to individuals in the Medicaid expansion population. This population includes people who are ages 19 to 64, not disabled, without dependents, with income between 100 and 138% of the federal poverty level. And we found out of 10,000 Benefits in Action clients, 2,000 may be affected, or about 20%. And if you are unsure about your eligibility or how these changes may affect you, give us a call at Benefits in Action. There will be a new work requirement form, Worksheet J, on the Medicaid application to determine if you are exempt. And there will be a work requirements screener tool on the Health First Colorado website for members to learn if requirements apply to them. And we have linked this below on this slide. The retroactive coverage restrictions will begin January 1st, 2027. For the Medicaid expansion population, they can only receive coverage for 1 month prior to the month of application. For children, adults over 65, and individuals with disabilities, they can receive 2 months of retroactive coverage prior to the month of application. And previously, this was 3 months for all members. This is a timeline of the rollout for the changes that we've just discussed. In July of this year, notices were sent to affected immigrant members. In August, notices were sent to members that may be affected by the work requirements. In October, the qualified immigrant changes will go into effect. In November, the notices for the January renewals or 6-month renewal start will be sent. And in January of 2027, the following will go into effect: 6-month renewals, work requirements, and the retro coverage rollback. Upcoming changes for SNAP include the qualified immigrant changes. These went into effect April 9th of this year and were said to have affected approximately 9,000 SNAP recipients in Colorado. The following will still be eligible for SNAP: U.S. citizens, certain members, including children of mixed status households, legal permanent residents, Cuban and Haitian entrants, and citizens of the Compact of Free Association nations. Those no longer eligible include refugees, asylees, and parolees. Cover All Coloradans is an act that was brought to us by House Bill 22-1289. This act provides Medicaid coverage to pregnant people through 12 months postpartum, children's ages 18 and younger, and regardless of immigration status. The upcoming Cover All Coloradans changes will affect only children. And we will review a timeline for these changes on the next slide. Dental benefit changes will provide a cap of $1,100 per year. There will be an enrollment cap, so new child enrollment will freeze if it reaches 25,000. Kids Medicaid only, so children under CHP plus, will be moved to full state Medicaid plan. And children will no longer qualify for long-term services and supports. This timeline also includes additional changes that are services that are not covered by benefits in action. So please visit the link attached, or you can contact Medicaid's member services for more information on those changes. Effective July 1st are the dental cap of $1,100 for children and the enrollment cap of 25,000. In January of 2027, no more Cover All Coloradan children in CHP Plus will be part of state-only Medicaid plan. So those will be consolidated into the state-only Medicaid plan. And there will be freezing of long-term services and supports for children with a legacy population.
All right. Thank you, friends. Thanks, Kelly and Anna. We are still in interpretation mode in case, well, I guess actually we're just using the Q&A. Let me see if I can pull that up since I'm hosting as well. Someone did ask if we can get a copy of this presentation to share with other clinicians. The answer to that is yes. You will receive a recording of this presentation once it has ended. Additionally, we can upload the slides and have those available for download as well as a PDF. So look in your email for a recording, and then we'll also get this posted on our YouTube channel as well, which you can find from our website. Thanks so much. If anyone else has questions, please drop those in the Q&A. And I'll just move to the next slide here while I'm looking for more questions to come. So once again, thank you for joining the Benefits in Action webinar today. If you need help applying for or renewing your SNAP or Medicaid benefits or benefits like Social Security, Medicare, etc., please call us at the number on your screen. That is 720-221-8354. Excuse me. Again, that's 720-221-8354. You can also find more information by visiting benefitsinaction.org to learn about our programs. We've recently added some additional pages to our website that detail more about programs like Medicaid for those with disabilities, Medicare, and more. So please check out our website at benefitsinaction.org. You can also email us at info@benefitsinaction.org if that is better for you than a phone call, or if you'd like to connect with us for partnership or other reasons as well. I do see one more question in the chat. Has anyone seen what is accepted for work exemption? Is it a Med 9 form? Kelly, do you perhaps have an answer?
Um, I think that they're still trying to look at that, and I'm not sure, to be honest, if a Med-9 form will be accepted or not.
So more information to come there. Yeah, we do recommend for specific cases to call Benefits in Action directly and work with us with one of our benefit navigators. And as more information becomes available, we will share that via our website. We do also have a newsletter that we share via email each month that can contain some of that information as well. Okay, I'm not seeing any other questions in the chat right now. Again, you'll receive a recording of this in your email. We will also post this to our website at benefitsinaction.org. Oh, one more important note for folks that are still here. We do have 2 more webinars this week. So tomorrow and Friday, we will have a webinar on Social Security and then a webinar on health benefit options. So this latter being more information on programs like Medicaid, Medicare, um, Connect for Health Colorado, and Medicaid for those with disabilities. So please visit our website if you have not already registered for those events as well. All right. We also have an awesome drag bingo fundraiser happening this Friday night at Hamburger Mary's. You can find more information on our website as well at benefitsinaction.org. We'd love to see you there for drag bingo for benefits. Thanks so much, everybody. Thanks, Anna. Thanks, Kelly. Great job, everyone. And please reach out if you have any other questions, call us directly, visit our website. Thanks so much.